Hi there, I'm your occupational therapist, Michelle. How are you?
I'm good.
Good. So I just talked to your doctor and he's cleared you for getting evaluated for occupational therapy. What I'll be doing is working with you to get you back to your regular activities, help you in areas that you're struggling with, so that way you can get back to life as regular as possible as soon as possible, okay?
Okay.
So what I'll be doing today is I'll be doing a couple assessments, including testing out the nerves that help control your head and movements of your eyes and everything like that, so we can kind of see if there's any issues with those things. Are you feeling any pain today?
No.
Okay. As we go, I'll be touching your face in places and giving you directions, so if you have any questions, let me know along the way.
Okay.
And are you comfortable starting this assessment now?
Yeah.
Okay, sounds great. So for the first one, I'm gonna have you plug one nostril and close your eyes, and then tell me what smell you smell.
It smells like lavender.
Okay? And then plug your other nostril and keep your eyes closed.
Orange.
Okay? And for this next one, I'm gonna have a little light shine into your eye just briefly so I can watch your pupils and see what they do, okay?
Okay.
So I'm gonna go this way first. All right, and then we're gonna do the other eye. All right, thank you. Let you blink for a second so that you can kind of feel a little bit normal again. Now for this next one, what I'm going to do is I'm gonna have you look straight at my eyes, but cover up your right eye. And then you're gonna tell me what number I'm holding up with my fingers, okay? So.
2. 1.
All right, and then switch eyes.
4. 2.
Okay. And then again, we're gonna kind of have you look at this green pencil just at the very tip of it. Don't move your head, just follow that tip with your eyes as I move it closer and closer to you. All right, great. And then again, you're gonna be watching that tip of that pencil. Don't move your head and just follow it with your eyes in the air, all right? For this next one, what I'm going to do is kind of test the sensation of your face, see what you can feel. So I'm going to have you close your eyes and just tell me when you feel me touching you, okay?
Okay.
Okay, go ahead and close your eyes.
Feel that. Feel that. I feel that. I feel that.
Okay. And then there's this other one to test the sensation also is going to be telling the difference between something sharp and something that's more dull. It's not too sharp, it's not going to hurt you, but it'll feel a little different. So
Okay.
if it feels sharp, just say sharp. If it's dull, say dull. Okay? Go ahead and close your eyes again.
Sharp. Dull. Sharp. 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 Dull.
Okay. This client had difficulty discerning between sharp and dull sensations on his face, as indicated with the red pluses on the illustration. This could be due to facial hair, but it might indicate nerve damage. Sensory nerve damage of the trigeminal nerve is a concern for the client. Lost sensation with this nerve could result in safety concerns. This could include while the client is shaving, he may cut himself. If he's drinking hot liquids, he may not feel the different temperature. Sun exposure could also lead to a severe sunburn, or cold exposure could lead to frostbite. Okay, so now what I'm going to have you do is just clench your jaw nice and tight while I feel the sides of your face, okay? Okay, and then I'm going to have you try to open your mouth as I try to hold it shut. So go ahead and try to open against me. Okay. Now we're going to see your facial nerve functioning. So I'm going to have you give me a big smile. All right, wrinkle your forehead. Give me a frown. Squint your eyes tight, really, really tight shut. All right, good. And then puff out your cheeks for me. Okay. This client had typical facial nerve functioning. Dysfunction would show asymmetry in the face, such as not being able to puff out one side or not being able to lift one eyebrow, paralysis, or a drooping eyelid, which could lead to dry eyes. Socially, this limits the nonverbal communication skills that the client has with the members of the community, which makes communication more difficult. This also leads to the client being more self-conscious and possibly being depressed about the way they look or the way they are perceived by others. This could lead to limiting occupations that the client participates in, as well as decreased social activity. All right, so what I'm going to have you do now is plug one ear so that you can't hear anything in it, and then tell me what you hear me say.
Cat, dog.
All right, and then plug your other ear, and then tell me which you hear me say.
Apple, banana.
All right, great. This, I'm gonna have you turn in a circle, just exactly where you are, so that you're facing me again. Okay, great, and then go the other direction. Okay, and then when you're feeling steady, are you feeling okay now?
Mm-hmm.
Okay, tip your head back just a little bit and give me a big ah. Okay. All right, almost done here. You're doing great. So now I'm gonna be putting my hands on you, trying to resist you moving. So I'm gonna put my hands on your shoulders, try to shrug them up while I try and push down. Okay, good. And then try to bring this ear to your shoulder while I push against you, and then the opposite direction. Okay, and then we're gonna have you try to turn your head towards the wall while I push against, and then the other direction. Okay, good. And stick your tongue out for me if you would, and wiggle it back and forth as quick as you can. Okay, good. And repeat after me. The quick brown fox jumped over the lazy dog.
The quick brown fox jumped over the lazy dog.
Okay, all right, that completes your cranial nerve assessment, and then we're gonna do some other assessments to see how other things are working and see how I can help you the best, okay?
Okay.
All right, thank you.